Hello and welcome to a lecture on locating health facilities. And we're going to use evolutionary algorithms to help us do this. So first of all, let's recap about location allocation modelling in general. So we know that when we're working with a health service client, we'll be doing one of several things. So that might be investigating accessibility to the service. How easy is it for patients to access facilities that deliver healthcare? Comparing the quality in terms of efficiency of previous decisions, and that's what we're going to look at today and in the labs. And also we might be generating alternatives, so we might be suggesting alternative ways to configure the system that would make it more efficient and improve patient outcomes. This is linked to optimization, and sometimes the problems you'll be dealing with, for example, if you're working with a single health facility, might be a small problem. So in those cases, it's best to try and support that as simply as possible. To help people understand things, usually a mix of developing a series of geographic maps to understand where demand is coming from and what type of demand is out there, and basic analysis is the best way to support those decisions. And it might be your analysis includes enumerating all possible solutions because there's only a small number of combinations you need to look at. But when we get to medium to large scale applications, we need to bring in some optimization theory. There's different ways to do that. Today we're going to look at evolutionary algorithms. But we do need to remember that we are trying to support people's decisions, not just solve an optimization problem. And that's really important to remember all the way through. The optimal solution to your model isn't necessarily the thing that decision makers want to do. They may want to see a variety of good solutions that can help them pick what to do. So here's an example of a facility location problem in healthcare, and we're going to use this as our example throughout. So this is from a real project. It's a study that's been published. This was working with public health teams in Hampshire and also a NHS provider of sexual health services. So these are clinics people go when they've got sexual health problems. So for example, in this chart of Hampshire, we can see different pieces of information represented. So the shaded geographic regions are postcode sectors, and basically the darker the sector, the more demand that we're seeing in that location. The second piece of information on the map is the location of sexual health clinics within Hampshire, and the size, those are the red buildings, and the size of those buildings is proportional to the amount of demand that they are currently serving. So this was a problem where the public health teams and the provider felt that actually they had too many facilities, and the type of care people were receiving when they walked into a sexual health clinic varied significantly across Hampshire. And there was also an issue with some of these clinics being underutilised. So they were keen to think about, if they consolidated to a smaller number of facilities, how many facilities should they choose and where should they be located? So it was a classic optimization problem. And too many locations to enumerate all possible solutions.